Brad Williams, Frugal Finance, Understanding Medicare Credibility Coverage and Pre-Existing Conditions. What is credible coverage? Credible coverage refers to health insurance plans, prescription drug coverage, or other health benefits that meet specific standards. These plans include employer-sponsored health plans, individual health insurance, student health plans, and various government-backed programs. The term is especially important for determining if an individual will incur penalties for enrolling late in Medicare or whether certain coverage restrictions, such as those related to pre-existing conditions, will apply. Key points to remember. Credible coverage includes health and prescription drug plans that meet a minimum set of qualifications. It helps determine whether individuals will face late enrollment penalties for Medicare or incur costs related to pre-existing conditions. Health insurers must disclose whether their prescription drug coverage is credible or non-credible for Medicare-eligible individuals. How credible coverage works? Credible coverage is most commonly associated with prescription drug plans. Health plans that offer prescription drug benefits to individuals eligible for Medicare must indicate whether their coverage is credible. If a policy's prescription drug coverage is deemed credible, it means that it offers at least the same level of coverage as Medicare Part D. This status is important because it affects whether you may face penalties for enrolling late in Medicare Part D. If you already have credible coverage, you can avoid the late enrollment penalty that comes with joining a Medicare drug plan later on. Additionally, those who hold credible coverage can sometimes qualify for subsidies. It's a good idea to keep any notice of credible coverage as it serves as proof of coverage when considering future enrollment in Medicare. If you let your credible coverage lapse and don't enroll in a Medicare drug plan during your initial enrollment period, you may have to pay a higher premium in the future. Requirements for credible coverage? To qualify as credible, prescription drug plan must meet the following criteria. It must cover both brand name and generic drugs. The plan should offer a variety of pharmacy options, including mail order services. It needs to pay for at least 60% of prescription costs. The plan should not have an annual benefits cap or should have a minimum deductible. You should have credible coverage through a number of sources, such as employer-sponsored health plans, federal employee health benefits plan, veteran benefits, TRICARE or CHAMP VA, Indian Health Services, COBRA continuation coverage. Additionally, covered by a spouse's health insurance plan might also have credible coverage. Credible coverage and pre-existing conditions. For those with pre-existing conditions, credible coverage plays a role in how these conditions are handled by health insurance. Although the Affordable Care Act made it illegal for insurers to exclude coverage for pre-existing conditions in most cases, there are still instances where such conditions can apply, especially if you had previous insurance policies that didn't cover certain conditions. While Medicare usually covers pre-existing conditions without requiring a waiting period, certain policies may have limitations. Before the ACA, many insurers would impose waiting periods for pre-existing conditions, but now this is rare except in special situations like legacy individual health policies that were purchased for March 23, 2010. If you had prior credible coverage, you may reduce the exclusion period for pre-existing conditions as long as there were no significant gap between your coverage periods. However, it is important to act within the designated window to avoid penalties and ensure that you maintain uninterrupted health coverage. Frequently asked questions. What is credible coverage? Credible coverage refers to health insurance or health benefits that meet specific minimum qualifications. It includes various health plans like employer-provided insurance and government programs. How can I tell if I have credible coverage? For prescription drug coverage, a plan is considered credible if it meets or exceeds the standards set by Medicare Part D. Most insurers must disclose whether their prescription drug coverage is credible or non-credible for Medicare beneficiaries. Will Medicare cover my pre-existing conditions? Medicare generally covers pre-existing conditions. There are some nuances. If you enroll in Medigap insurance, the provider will refuse to cover costs for pre-existing conditions during the first 6 months. After this period, Medigap policies will cover those conditions. Alternatively, Medicare Advantage plans also accept individuals with pre-existing conditions. Understanding your health coverage, whether it's credible or not, can significantly impact your enrollment decisions and the costs associated with pre-existing conditions. Comment if you have any questions as it relates to credible coverage and pre-existing conditions. Check out my long list of Medicare-related videos under the playlist Medicare. Brad Williams. Frugal Finance. Thanks for watching. Hope that helps. See you soon.